Hello, my name's Tristan. I'm one of the developers here at Socrates Healthcare, and I'd like to take some time today to give you an overview of our product. I'll be demonstrating some of its features and showing you how making the move from an older style billing-based system to a full PMA like Socrates can help you and your practice run more smoothly, generate more profit, and achieve even higher levels of patient care. This video is broken down into two sections. The first subject we'll cover is the clinical aspect of Socrates. That is, those areas relating to your patient's medical records and care. The second section will cover the administrative aspect of Socrates. Those areas concerned with the management of your practice, patient appointments, documents, and similar. And just to note before we move on to the clinical side of Socrates, what I'm going to show you today is really just a brief overview of the product. If there's anything you'd like to see that isn't covered in this video, please do contact us and we can show you more. So, let's move now into Socrates and we'll have a look together at some of the clinical features. What you see here is the main consultation screen. This will be your first point of contact when you see a patient. At the top of this screen, you can see the patient's basic demographics, contact and insurance details, and whether they currently owe you any money for previous consultations. On the left side of the screen is a summary of the patient's prior visits. This is a timeline of the patient's previous diagnoses, medications, notes, and similar. On the right side of the screen, you can see details of the most important medical information for this patient. So you can see here that this patient suffers from non-insulin dependent diabetes and hypertension, that they're currently taking atorvastatin for their hypertension, and that they also have a family history of COPD. You can also see at the bottom here that the medical records from a previous doctor have been attached to this chart, so you can access those while you're in consultation with the patient if need be. So as you can see, this screen is designed to provide you with the patient's most important clinical details as soon as they walk in the door, allowing you to get the consultation underway quickly and ensuring that you have access to a complete summary of the patient's history at a glance. Let's have a look now at some of the more specific features of Socrates' consultation section. One of the more common tasks you may perform is the recording of a patient's baseline details, such as weight, blood pressure, pulse, cholesterol, and social factors such as smoking and drinking habits. The baseline details section allows you to record all of those details conveniently in one place. This is more than just a simple record keeping section though. You can see a patient's statistics graphed over time in 2D or 3D. This patient shows a clear upward trend in their blood pressure and cholesterol levels. You can also automatically calculate their risk of a cardiovascular event using the Framingham study. This patient's 10-year risk has jumped from 2 to 7% over the last 2 years. And for children, you can compare their growth against a standard chart of height and weight over time. All of these features are designed to make diagnosis and ongoing care quicker and easier for you. Let's now unlock this chart for editing to allow us to add some new information to it. Just a quick aside on that, features in Socrates can be locked down to allow you to control exactly who in your practice is allowed to perform certain tasks such as viewing or editing patients' charts, prescribing medications, or viewing financial transactions. This gives you very fine-grained control over the security of your practice and is a huge help in minimising the risk of loss and fraud. We're going to quickly skim over the procedures and notes sections, but as you can see here, Socrates comes preloaded with the full list of procedure codes and ICD codes. It also features integration with Medibox for price lists and MedPrax for drug data, and everything you enter here is automatically exported to the billing section so that you can claim or invoice in just a couple of clicks. Here you see Socrates' medication section, where you can keep track of prescribed or dispensed drugs, as well as any other consumable items used during a consultation. Looking at our patient's atorvastatin, you can see the amount of control you have over a prescription's details. As well as the drug, ICD code and quantity, you can add patient instructions to be added to the drug's bottle, record additional notes, and Socrates will keep track of how long is left before the patient requires a checkup for this prescription. If you prescribe a particular drug regularly, you can also set up a standard script. This will fill in all of these details for you according to your template with just a couple of clicks. I just prescribed a month's course of amoxicillin in less time than it took to complete the sentence. One final feature of note in the medication section is the ability to record allergies. You can record both drug and non-drug related allergies, and Socrates will automatically remind you of any recorded allergies before you try and prescribe to the patient in future. Socrates also includes a full system for tracking immunizations administered or due to patients, and will automatically provide stock control for your vaccines without any extra effort on your part. You can also record any adverse reactions a patient displays here too, in a similar fashion to drug allergies. The last part of the consultation screen that I'd like to show you is the investigations section. Here you can record any tests given to the patient, anything from brief patient questionnaires to detailed lab tests. This section is fully customizable, so as well as the preloaded list of common tests, such as a full blood count or thyroid function test, you can design and include your own custom ones. Here you see a custom designed family history questionnaire that allows you to record a whole list of family histories in one convenient location. I'd like to finish up the clinical section of this video by showing you the reporting area of Socrates. Almost everything you've seen in this video so far can be reported on, whether you want to know how many of your patients are over 60, who had a heart attack in the last year, or who was on a particular drug. Let's pick that last one. This is the full patient listing report, which allows you to search your entire patient database using an incredibly comprehensive list of criteria, from age and gender to ICD codes, prescriptions, investigations, immunizations, and more. We're going to search for patients currently on atorvastatin. We simply select our drug in the relevant section and click OK, and we immediately have a list of all patients on that drug, just our test patient in this case. As well as simple lists, you can use reports to generate mail merge letters. So if you want to instantly generate letters for all your diabetic patients who've not been to see you in the last 6 months, you can do that. Socrates also includes a full range of financial reports from daily summaries through to detailed money owed and age debtor reports, making keeping track of your income and maximising profitability incredibly simple. That's the end of the clinical section of this video. We've really just brushed the surface there of the ways in which Socrates can make your daily work easier, improve your patient care outcomes, and boost profits. We'll now move on to look at the organisational side of Socrates, and how it can do the same for your administrative staff. The first of Socrates' admin features I'd like to cover is the management of patient appointments. This is the appointments screen. Looking at the top of the screen here, you can see that each healthcare professional has their own column for appointments. Making an appointment is as simple as double-clicking the appointment slot you'd like to book, choosing a patient, and changing any details you wish to modify, such as the appointment type, duration, or attending doctors. You can also check a patient's medical aid eligibility from this screen to ensure they have cover as you book the appointment. By default, we're seeing all doctors and nurses here, but you can also break the screen down into separate views for your doctors and nurses, or by site, however you'd like to organise it. I've created a separate view for surgeons here, which is just showing myself. You may have noticed that these empty appointment slots are two different colours. The lighter colour indicates that this healthcare professional is available at that time, and the darker indicates that they're not. The appointment screen allows you to record daily and weekly schedules for your staff. It also records holidays and periods where staff are at a different site or out making house calls or similar, so that all the information you need to manage your staffing is available to you in one place. The next feature I'd like to show you is closely linked to the appointments diary. This is the waiting room screen. This screen allows you to see which patients you're expecting to see today, who's arrived and is waiting to see a doctor, who's in a consultation right now, and who's already been seen today. This is the patient's expected view. Here you can see the list of patients with appointments today. When a patient arrives at the reception desk, you simply double-click them here, and then move into the patient's present view. And that happens across the practice so that anyone else looking at the waiting room screen can see that that patient has arrived. Once the doctor or nurse calls the patient in and starts a consultation, the patient moves to the in consultation view, so that you can see the patient is now being attended to. All of this is designed to make the task of managing the flow of patients through your practice as smooth and simple as possible. No need to talk to or intercom your doctors to let them know who's arrived. Everything can be managed from this one screen. As well as managing patients who have appointments today, you may also be taking telephone calls and performing other tasks, and here I'd like to show you a couple of features that will help you with that. In the top right corner here, we have the Contacts and My Tasks tabs. The Contacts tab allows you to send an instant message to anyone else in your practice currently logged into Socrates. You can use this to make a doctor aware of something without disturbing a consultation, or just to let a colleague know you'd like a cup of coffee. If you'd like to make a slightly more permanent note of something, you can use My Tasks. This allows you to remind yourself that you have to do something, such as ring a certain patient with their results. You can also assign a task to someone else. So if a doctor needs to call someone back, you can assign a task to them, and you can monitor that task to see when the call has been made. Another feature I'd like to show you is the document management screen. Here you can control the flow of documents in your practice. Whether they've been received in the post, by fax or by email, you can quickly attach them to your patient's chart here so that you have a permanent electronic copy of the document and can dispose of or archive the original, safe in the knowledge that the document will always be quickly to hand when dealing with that patient in future. Let's attach a file we've received by email to the patient's chart. We simply select our patient, then browse to our desktop where we saved the file, give it a name and assign a category and type. That file is now permanently attached to the patient's chart. You can remove the original from the desktop or wherever you saved it first. The process of scanning a physical letter into a patient's chart is exactly the same, and in fact Socrates has an additional batch scanning feature which allows you to quickly deal with a whole day or even week scanning all at once to save time. Any documents or scans you save here will be attached to your database, allowing them to be easily included with your regular backups so that all of your patient information is safe from loss by fire, theft or accident. Just before we finish up, I'd like to show you how simple claiming is with Socrates' integrated live claiming system. This is the billing screen. You can see here a procedure we performed earlier that is waiting to be claimed for. To claim for this item, I simply click to select it and then press the claim button. Wait a couple of seconds, and then hit refresh, and we can instantly see that the charge for this item has been accepted by the patient's medical aid. This screen also allows you to print invoices for patients, record payments when you receive them, and view archives of older claims and invoices, so that everything you need to manage your practice income is here in one convenient location. That concludes the admin section of this video. Once again, I'd like to remind you that this has just been a very brief overview of some of the features of Socrates. If there's anything you didn't see today that you'd like to see, or if you'd like to know more about anything you did see, please do drop us a line.